Thank you for showing interest in learning about lower extremity injuries, which include the knee, the muscles in the thigh, your calves, your foot, your ankle. We're going to go over some tests that you can do at home to determine how much function these parts have. We're going to tell you how to score them and what some things mean. This will be by no means a way to self-diagnose, since lots of other factors go into that. But this will be able to simply tell you how much function is there in these parts. It won't tell you what's stopping the function, but it will give you a general idea of how healthy those parts are. This first test is going to go over knee health, so the knee joint itself. There's a number of things that can cause knee pain, but the knee joint is the first thing that we look at. The goal here is to be able to bring the heel to touch the butt with ease, with the thigh straight in the air. If you cannot touch the heel to the butt, the rule of thumb is this: every inch lost in function, every inch between the butt and the heel is a loss of 10% function. And one quick and dirty thing we'd use in our office is we go with a finger width. One finger width is generally 3/4 of an inch, so that is a loss of 7.5%. So a loss of 2 finger widths function is 15% function. Here we go. All right, so for this right side here, the test is very simple. If you have a friend, to be a little more specific about things, that friend is going to grab your thigh and bring your thigh straight into the air, keeping the thigh straight up and down, and you should be able to bring this heel all the way to their butt. As you can see here, we can't do that. And with May, we have about a loss of 3 finger widths. How'd that feel on your end?
Nothing.
She has very few symptoms, so one of the things that can limit this range of motion is arthritis or degeneration. It's possible May has some of that. So 3 finger widths leaves you at about 22% loss of function in this knee. If you wanted to do this on your own, all you got to do is grab the front of your shin and try to pull it all the way to your butt. As you can see, this is challenging, and she's got a little extra finger width loss of function there. So it's not as clear and definitive as a partner test, but it can give you a pretty good idea of how healthy something is. There's really no thing you need to look out for cheating. The other leg should be straight in the ground, and it doesn't matter if somebody is overweight or there's something, well, what if they're really heavy and now their butt's bigger? Well, guess what? So is your thigh. Everything is going to equal out. So it doesn't matter regardless of somebody's body configuration or body type, the heel should be able to touch the butt with ease. That is 100% function. Every loss of an inch is 10% loss of function. All right, let's move on. Now this next test will also contribute to knee pain if it's not full. But this doesn't check the knee joint itself, but the front of your legs, the muscles in the front of your thighs known as your quadriceps. You should be able to bring your heel to your butt, just as with a full knee joint test, but you should also be able to bring that knee off of the table or floor or whatever 2 full inches, and there should be very minimal symptoms. No extreme pulling. It should be a mild pull, if anything. So, since May did not have full range of motion in her knee, we have to discount that test is added onto this. So we already know that heel is not going to touch the butt. Now, for this test, we did the test on her right knee initially. That was 3 finger widths away. Off camera, we tested the left. It was 2 finger widths. So I'm going to bring this heel to the butt. I can go about 2 finger widths away, and now we've just about replicated what the function is for the knee itself. Any other restriction past this is going to be a reflection of the muscles in the front of her thigh. How does this feel right now, May?
There's nothing.
There's nothing right now. So right now, we're at a neutral amount of test, really. So what I'm gonna do is I'm gonna bring this knee up. I'm gonna grab right underneath and I'm gonna pull this up, maintaining that same 2-finger width restriction. As I lift this up, what's this feel like?
Well, there's a stretch in my quad and I feel it in my lower back.
So that stretch in her quad is telling me there's likely some scar tissue on the front of her thigh muscle that's not allowing the muscle to stretch out. And because it's not stretching out, it's pulling on its attachment at the hip, which is causing the hip to move and creating some tension in her lower back. This is a sign of something that can be fixed. So this is the test by yourself. Very difficult to do. But I would say, if you have a friend and you're laying on the floor, you take the webbing of your thumb and index finger on the shin, so you're not pressing into the bone. You're pressing that all the way to whatever test amount was allowed during the first knee test. You can keep it there with one hand, and then you should be able to lift 2 inches up. And that's the test. That should be pain-free, symptom-free, full range of motion. Every loss of finger width is roughly the same as monofunction as the knee test. It's a little less clear though. The true clinical testing requires a chart and measurements of angles of the thigh and the shin, and well, that's not so easy to do by yourself. But just know, this should be easy and pain-free. So what we're going to do now is we're going to test for hamstring strength, which is super common in athletes and can lead to a lot of lingering back pain, even if everything else is healthy. So do a lunge. What you have to do is step forward, striking with your heel, dropping your knee down, chest upright, and then returning to that point. So your toes come off, your heels come off. Your heel is the first thing to touch the ground and the last thing to leave. There should be no heel dragging. The toe shouldn't be pushing off. It should always be the heel. When your heel is planted, that means that everything is very fluid and you don't look like you're going to fall over. That means your hamstrings have sufficient strength to keep you balanced and to provide this range of motion. Signs of a failed lunge would be using your hands to push off your thighs to help out, a toe drag, a heel drag. Any of those would indicate that you have less than optimal strength in the hamstrings.